everybody. This video is going to be discussing obsessive compulsive disorder, also known as OCD. In this specific video, I'm not going to be discussing it merely as a topic. I'm actually going to be going over a few questions to ask yourself as a self-assessment. This is in no way, shape, or form meant to serve as a diagnostic tool. It is important to seek a mental health professional if you do suspect if you need a diagnosis of obsessive compulsive disorder. This is a means, however, to self-assess and to better be able to get a blueprint and really ask yourself if you believe you may be having obsessive compulsive disorder symptoms. So these 8 questions are all designed and modeled after individuals who do have this diagnosis and who are experiencing those anxiety-inducing thoughts, repetitive behaviors that they believe to be uncontrollable and compulsive. So this is not a diagnosis. It is a valuable first step into taking incremental actions to seek treatment if you suspect you may have OCD. So how is OCD treated? It is highly treatable, often through a combination of cognitive behavior therapy, and in some cases medication can help too. Now there are 8 questions that I'm going to ask here, and you would answer to yourself. The way that it is measured is you're going to answer frequency of these symptoms. So it's going to range from never, rarely, sometimes, often, and very often. You're going to go ahead and rate yourself on that scale depending on what the question is asking. So keep those in mind. Number 1, do you ever experience unwanted, repetitive, and persistent thoughts that cause you anxiety? Number 2, do you ever fear contamination, i.e. germs, from people or the environment and engage in excessive cleaning? Number 3, do you experience the need to constantly check on something, i.e. repetitively checking to be sure doors are locked, light switches and or appliances are off, or arrange the order of things, such as a shelf in a bedroom or a kitchen cabinet? Number 4, do you experience intrusive thoughts that are aggressive, such as thoughts that are harm to yourself or others, or taboo topics? Number 5, do you attempt to ignore / suppress these unwanted thoughts / images, or engage in another activity such as counting, hand washing, checking repeatedly to be sure our doors are locked, to neutralize them, and if so, how often? Number 6, do you engage in rituals that provide temporary relief to your anxiety, such as counting, checking, or cleaning? Number 7, do you spend at least 1 hour a day thinking obsessive thoughts or performing ritualistic behavior in an attempt to avoid angst? If so, how often? And number 8, is your job performance, home life, or social relationships significantly affected by your obsessive thinking or ritual behaviors? Now those are 8 questions just to give yourself a self-assessment if you are curious whether or not you fall into this specific diagnoses. It's very important to be honest with yourself. It's very important to thoroughly research and make sure that you're getting as much information that can be supportive and helpful towards you. I hope this video has been well. Have a great mental health day. Thank you.